Why is PVR important for urinary retention? Have you ever wondered how doctors assess urinary retention? One key measurement they use is post-void residual urine volume, often called PVR. This measurement is crucial because it tells us how much urine remains in the bladder after someone has urinated. A high PVR indicates that the bladder isn't emptying completely, which is a primary sign of urinary retention. Understanding why PVR is important involves a few essential points. First, it provides an objective diagnosis of urinary retention. While patients may report symptoms like feeling like they haven't fully emptied their bladder or experiencing a weak urine stream, these symptoms can sometimes be misleading. Some individuals may have significant retention without any noticeable symptoms. By measuring PVR, healthcare providers can confirm urinary retention accurately. Next, PVR helps assess bladder function and identify underlying causes. The bladder's ability to contract and the urethra's ability to open are both essential for proper urination. If PVR is elevated, it could mean there is an issue with how well the bladder muscle is working or that there is an obstruction, like an enlarged prostate or a narrowing of the urethra. Knowing the PVR helps doctors determine the severity of the issue and what might be causing it. Another important aspect of measuring PVR is preventing complications. When urine stays in the bladder for too long, it can lead to infections, bladder stones, or even damage to the bladder muscle. Over time, high PVR can increase pressure in the bladder, which might harm the kidneys. By keeping track of PVR, healthcare providers can catch these problems early and take steps to prevent them. PVR measurement also guides treatment and monitoring. Doctors use this information to evaluate how well treatments for urinary retention are working. Whether it's medication, catheterization, or surgery, knowing the PVR helps determine the best course of action. If PVR remains high, it may be time to refer the patient to a specialist. There are practical ways to measure PVR. One common method is using a bladder ultrasound scanner, which is non-invasive and quick. This method is often preferred for routine evaluations. Catheterization is another option, but it is more invasive and usually reserved for confirming results or providing immediate relief. In the broader context of bladder health, understanding PVR is vital. Urinary retention can complicate bladder function and may mimic symptoms of other issues, including bladder cancer. Accurate measurement of PVR ensures that patients receive the right evaluation and management, helping to avoid misdiagnosis and secondary complications. In summary, PVR is important for urinary retention because it provides a reliable measure of how well the bladder empties. It helps identify underlying causes, prevents complications, and guides treatment decisions. If you have concerns about urinary retention or bladder health, it is always best to consult a healthcare professional for personalized advice.